2006, when then Prime Minister of Japan Junichiro Koizumi visited Ghana, the name of a certain man came to his mind, Dr. Hideyo Noguchi. Hideyo Noguchi, who was working at Rockefeller Institute, was the first Japanese medical doctor to gain recognition in the land of Africa. He went to Accra, Ghana, to study yellow fever, and unfortunately lost his life to this disease within several months. The year was 1928, and he was only 51 years old. With advanced public health and medical science, we now enjoy better health. However, epidemics of many infectious diseases still exist in Africa and elsewhere around the world. Now more than ever is the time that we must inherit Noguchi's will, thought Koizumi, and thus he established an award for a medical scientist and for a leader in healthcare systems who greatly helped African people. This is the Hideyo Noguchi Africa Prize, and the award is comparable to the Nobel Prize.
本当に嬉しいことで、日本がこういうことをするのかということで、さらに評価が高くなっているのは間違いないですね。日本がそんなことしてくれたのということで、ものすごく喜んでいるということが、会う人ごとに言われるので、もう本当に嬉しいことだと思いますね。受賞した人方々の喜びの声がね、やはり周りに広がっていくことこそがね、そういう人たちがやはり日本のことをパートナーだと思っていることがすごく嬉しいなと思います。これはもうぜひ続けてほしいし、こういう形のものをね、やはりこれからも小さくてもやっていくことがすごく大事じゃないかなと思います。
The award ceremonies were held at the TICAD of 2008 and 2013 in Yokohama. Here we introduce the 4 laureates of the Hideyo Noguchi Africa Prize. Professor Miriam Were. For over 40 years, Professor Were has dedicated her life to the improvement of health and welfare of the African people, especially women and children, and for provision of primary health care in the community.
I am Professor Miriam Were, currently the Chancellor of Moi University. Since receiving the prize, I have been invited to many other bodies. I am a member of the Champions for AIDS-Free Generation in Africa. My focus has been on community health. We must focus more on promotion of health, like nutrition, as well as preventing disease, such as through immunization and through hygiene. And this is one way that Africa can control how much money is spent in the health sector. So I would like to encourage young medical researchers and young medical service specialists to really be committed on health prevention, health promotion, as well as being good clinicians to provide good services to our people. Hospitals don't change health, they treat disease. Thank you very much and best wishes.
Professor Sir Brian Greenwood. For over 30 years, Professor Greenwood has worked based in Africa on research and practical measures against malaria and other infectious diseases.
So I'm very honoured to be one of the 2 first recipients of the Hideyo Noguchi Prize, and I'm very grateful to the government and people of Japan for establishing this prestigious award. I considered how best one could use the considerable sum of money that comes, prize money that comes with this award. I thought that the best thing to do would be to establish a scholarship program for young African scientists that would allow them to undertake a master's degree. During the past 5 years, over 4,000 applications have been received, and it's been possible to make 30 scholarship awards.
Professor Alex G. Cortino. Professor Cortino is a pioneer for increased access to treatment for HIV-positive people in Africa, where 70% of the world's HIV-positive patients live.
I received this prize in recognition of the work that I and many others had done in scaling up HIV services. Since I received that prize, I have now applied the knowledge that I have accumulated over 35 years as a doctor in scaling up medical services to new challenges. It's important that prizes like the Hideyo Noguchi Africa Prize are supported and encouraged, because it will encourage the younger generation of Africans who are coming up in the field of research and medical service delivery to aspire to one day also be recipients of this prize.
Professor Peter Piot. Professor Piot's career in Africa began with his discovery of the Ebola hemorrhagic fever some 40 years ago, and his work has been instrumental in raising HIV/AIDS as a major global issue.
Receiving the Hideyo Noguchi Africa Prize was definitely one of the highlights of my career. In the first place, because Dr. Noguchi is a truly universal role model for all of us in global health. And I trust that the prize now will attract the best of Africa's researchers so that their work can receive all the support that is needed.
Japan will continue to promote the Hideyo Noguchi Africa Prize and to call for international cooperation for improvement of the health and welfare of Africa, whilst continuing to take a leadership role in the field of global health for this important global cause.